Mark, thanks. School is right around the corner, and one of the many things on that list of back-to-school tasks is getting back-to-school vaccinations. Joining us now to talk about the importance of those vaccines is Danielle Stipes with the Tennessee Department of Health. Thank you so much for joining us today.
Thank you for having me.
Well, first off, why is it important for folks to go ahead and start thinking about back-to-school vaccinations right now?
Back-to-school vaccinations are a great way for our children to be healthy in school and ready to learn. Vaccines optimize our children's health, keeps them in school, prevents diseases such as measles, mumps, rubella, chickenpox, and it keeps the kids' absences down and unplanned school closures to a minimum.
And I know you just mentioned a few of those, but which vaccines should parents be keeping an eye out for when it comes to going back to school?
That is a good question. It's a question that's frequently asked when we have parents coming in.
Yeah.
And so it's important to realize that vaccination schedules are an ongoing conversation to have with the pediatrician's office. So this is great to start the conversations at birth, but then we're like, our kids are here, they're in school now. So we're looking at preschool to kindergarten, that 4 to 6 year old range. We're looking at those booster doses of Dept, polio, MMR, varicella. Moving on to 7th grade, those rising 7th graders, 11 years old, we're looking at that booster dose of Tdap, even recommended vaccinations such as HPV and the meningococcal ACWY vaccines. One that we don't typically think of that's just as important is our rising kids going into higher levels of college. So if they're going to be living in a dorm, in a university setting, it's best to look at those because there's some requirements as well, looking at meningococcal vaccines too.
Well, I was just about to ask, you know, when I went back to school, I remember there was a checklist of everything, and especially when you go off to college, like you mentioned, you know, you don't think about it at that age, but that's also important to keep in mind.
It is very important. They think that they're finished, and yet they get this long list, and they're like, what do I do now? So it is good to go ahead and think about that once they turn 16.
Let's talk about the impact of vaccinations and what this does when it comes to preventing outbreaks of diseases and just keeping the community healthy and safe.
So when you think of vaccines, you're like, oh, it's just a shot, but it's really not. Vaccines prevent disease and prevent disease transmission. So doing so, it will increase herd immunity in our community. So individuals that may not receive vaccines, such as newborns, they're not eligible based off of age for certain vaccines, as well as our vulnerable populations. Think of our elderly, pregnancy. They're not able to receive those certain vaccines at certain times. So if they are able to get those vaccines and we have herd immunity, it will be less likely for disease progression to happen between person to person.
And I know you mentioned earlier as well, when it comes to school, you know, we hear a lot about schools having to shut down for flu. Obviously, we know about COVID a couple of years ago. How was it impacting the school systems as well?
Flu is always a concern, especially going into flu season, which is typically October into March. And so flu is very contagious, and so it's very important to think about those flu vaccines because it's not a recommended, hey, we're back to school, we need to get this. It is a seasonal vaccine, and it is very important to have those conversations with the pediatricians, as well as anyone that would like to call the health department. We can discuss those based off your child's health history and needs.
And speaking of that, where do parents need to go when it comes to getting their child vaccinated and also finding out what vaccines their kids need? That
is great because you're thinking, what do I do now? It's time, what do I need? So obviously the first step is the pediatrician's offices. You think, oh, I go there for those physicals, let's go ahead and take care of that. We also can take care of immunizations at any of our local health departments. So if anywhere that's close to them, they can give us a call. If they have got questions of, you know, my child was in preschool, but now they're going into kindergarten. Do they need new shots? Give us a call. We'll be happy to look through those shot records with you, explain what they need, and maybe even look at a forecast of what they would need in the future.
All right, well, great information. Thank you so much for coming by here on First at 4 today.
Thank you. We're glad to be here.
All right, well, plenty of